Hi, my name is Minley, and I will be presenting my policy presentation, and it will be about opioid use and pregnancy. Topic background. So, the Association of Women's Health, Obstetric, and Neonatal Nurses Association's mission is to empower and support nurses caring for women, newborns, and their families through research, education, and advocacy. There is an outlined agenda from the AWHONN for legislative and policy priorities, and one statement outlined was optimizing outcomes for women with substance use disorders and pregnancy in the postpartum period. Opioid use continues to rise, and opioid use during pregnancy is not excluded. From 2010 to 2017, the number of women who were diagnosed with an opioid-related issue during hospitalization for delivery has increased by 131% according to the CDC, and that was in 2024. Untreated mental health disorders and substance use disorders can lead to high-risk pregnancies, poor infant outcomes, and increased risk of maternal mortality. Barriers to providing treatment to the specific population need to be decreased and improved. Pregnant women often face judgment for having a substance use disorder, but there is also fear of punitive outcomes as substance abuse is reported. Many are under the impression that if there is a positive substance abuse drug result, their child will be immediately taken away. State laws vary from state to state, but by 2019, DC and all states defined abuse or neglect to include prenatal drug use. State laws require healthcare providers to report prenatal drug use to Child Protective Services. So oftentimes pregnant women do face judgment from healthcare providers and society, which may lead to delayed prenatal care. So the American Society of Addiction Medicine wants to advocate for a reversal of punitive approaches taken to substance abuse and substance use disorder during and after pregnancy to an approach backed by evidence-based treatments. Substance abuse disorders during the prenatal period, which includes tobacco, alcohol, prescription medications, and illicit drugs, have significant health impacts on both mother and the baby. So the topic would be promoting health equity and improved outcomes for pregnant women with substance use disorders. And the issue identified is fear of punishment discourages women from seeking prenatal care that would improve pregnancy outcomes. The landscape factors include social. Pregnant women with opioid use disorder often have co-occurring mental health disorders, which may include depression, post-traumatic stress disorder, and anxiety. The CDC states that suicide and overdose are the leading causes of maternal death within the first year of the postpartum period. Findings from a study concluded that pregnancy influences a woman's behaviors and changes in social relationships due to pregnancy. Constant interaction with individuals who practice high-risk behaviors increases the risk of overdosing and engaging in high-risk behaviors themselves. There is also the same effect if there is interaction with individuals who do not engage in high-risk behaviors. Therefore, there is a lower likelihood of engaging in high-risk behaviors. The economic factors are pregnant women do not seek help for substance use disorders due to cost, lack of insurance coverage, or lack of knowledge on how to obtain these resources. To assist in this, there needs to be adequate access to psychosocial support services, treatment programs, and contraceptive services. Unintended pregnancy rates among women with substance use disorders are approximately 80%, which is higher than the general population. There has been an increase in opioid use in pregnancy, leading to an increase in neonatal abstinence syndrome. From 1999, there has been a reported 1.5 cases per 1,000 hospital births to the latest in 2013, which is 6 per 1,000 hospital births. This rate increase has estimated to cost approximately $1.5 billion in annual hospital charges. States with higher rates of opioid prescriptions also have a higher rate of neonatal abstinence syndrome. Legal and political factors. Many pregnant women hesitate to seek proper prenatal care due to punitive state-level policies, prior negative personal experiences with the healthcare system, and fear of child welfare involvement. In states with mandated reporting, policymakers, legislators, and physicians need to work together to repeal punitive legislative and identify and implement evidence-based strategies outside of the legal system to address the needs of pregnant women with substance use disorders. Ethical. Many studies on substance use disorder in pregnant women have met the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, criteria for opioid use disorder and were at least 18 years of age. Participants were also informed about their involvement in the study and had consent forms to sign. Many participants were willing to share their substance abuse history to improve the health of their infant. The policy options include the Comprehensive Addiction and Recovery Act of 2016, or CARA, the Nurturing and Supporting Healthy Babies Act, NAS, or the Improving Treatment for Pregnant and Postpartum Women Act of 2016. The Comprehensive Addiction and Recovery Act of 2016's purpose is to address the opioid epidemic and expand access to addiction treatments, recovery options, and educational resources. This includes additional funding for treatment for pregnant and postpartum women. This act was proposed based on 6 key points: prevention, treatment, recovery, law enforcement education, criminal justice reform, and overdose reversal education. Through CARA, $181 million in funding is granted across the United States to address substance abuse recovery. So in this table, it is outlined basically what the purpose of each section is and eligible applicants for this area. The Nurturing and Supporting Healthy Babies Act's purpose is to provide Medicaid coverage for treatment services for neonates with neonatal abstinence syndrome. It also mandates that the Government Accountability Office report on NAS, including its prevalence, barriers, and best practices, leading to the increased instances of neonatal abstinence syndrome. Many pregnant women do not seek help for substance abuse disorders due to cost, lack of insurance coverage, or lack of knowledge on how to obtain these resources. So basically, the focus on the reporting is to identify federal obstacles to care and improve care for NAS babies due to specialized care, increased treatment costs, and extended hospital stays. The Improving Treatment for Pregnant and Postpartum Women Act of 2016's purpose is to provide additional support for pregnant women with substance abuse disorder and to expand support for residential substance abuse treatment programs. This act allocates funding for residential substance abuse treatments and is geared toward family-based services. Through this act, $40 million in funds is awarded each fiscal year. While CARA offers a broader systematic funding, the NAS Babies Act aims to improve neonatal outcomes, and the Improving Treatment Act directly addresses maternal care and prevention, making it the most comprehensive policy for long-term impact. Although funding is lower than that of other acts, the key provisions make the act stand out, rendering it a well-rounded act that provides treatment support in all areas. These would be the stakeholders involved. These stakeholders are responsible for or affected by healthcare policy and is essential for all parties to participate in discussions or meetings to facilitate effective collaboration. These collaborative efforts enhance the potential efficacy of policy writing, renewal, or revision, including preparing research, conducting research, sharing evidence, and implementing evidence. So some of these stakeholders would be the AWHNN, the AWHP, the SWHR, the NIH, patient advocates or the patients themselves, policymakers, providers, and the general public. Potential advocacy, so promotion of policy can be achieved through different avenues. One example is utilizing the public health service officers who can provide education and focus on specific women's health issues. Federal agencies or major organizations can deploy these officers. Media campaigns can be tailored to educate others in various learning styles, whether they are visual, auditory, or hands-on learners. Media campaigns can also be performed in different languages to incorporate the cultural background associated with them depending on the target audience. These stakeholders can also schedule meetings and review ongoing agenda items, advocacy campaigns, research grants, and identify potential challenges, allowing them to prioritize accordingly. Regardless of the type of promotion method used to raise awareness among the target audience, all information must be clear and concise. Here is the infogram that was included. So, in conclusion, we will talk about here every pregnant woman deserves access to respectful, non judgmental care that promotes recovery and wellness. When fear and stigma prevent women from seeking help, both mothers and infants suffer. Replacing punitive measures with policies such as the Improving Treatment for Pregnant and Postpartum Women Act of 2016 can transform maternal health outcomes through education, community support, and evidence-based treatment. Continued advocacy from nursing and public health organizations is essential for these changes to achieve health equity and promote healthier generations of families in the future. In this infogram, it just outlines the different policy options, the lack of prenatal care, and some statistics for the state of Missouri and for the United States as a whole. References, and thank you for your time. Bye.